Proposal: AI Health Companion for Remote Areas. Challenge question: without relying on available internet or professional medical staff, how can we leverage cloud-native tools and AWS Generative AI for delivering accessible or intelligent healthcare guidance to individuals in remote regions? High-level approach. We are building an AI health companion, which is a secure web-based application and a lightweight component. It enables users to explain their symptoms and responds with AI-powered intelligence and gives feedback to the symptoms. The tool is designed for use in infrastructure-limited or bandwidth-constrained areas. It utilizes AWS Generative AI tools in a serverless and cost-efficient architecture. Features: utilizing Amazon Bedrock for checking symptoms and medical Q&A. Utilizing DynamoDB for chat history logging. Utilizing API Gateway and AWS Lambda for connecting lightweight front-end. Using CloudWatch for debugging/monitoring. Using Amazon Q for structured guidance optionally. Securing the image or reports uploaded in Amazon S3. Cost optimization strategy. Amazon Bedrock. Using Anthropic Claude Instant or Amazon Titan for cheaper inference. API Gateway. Utilizing 1M requests/month free model. AWS Lambda, 500-1000 Lambda invocations. Amazon S3, 1 GB S3 storage, initially storing small data, less than 1 MB. Amazon DynamoDB, 100 KB Dynamo data, pay-per-request pricing. Amazon CloudWatch, using only necessary logs for debugging. Estimated cost for demo or testing. Total monthly cost, testing plus minor scale $10 to $18. Reference architecture diagram. One user sends input from web/mobile app via API Gateway. Secondly, API Gateway forwards to Lambda. Thirdly, Lambda prepares and sends prompt to Bedrock. Fourthly, Bedrock returns generated AI response. Fifth point, response stored in DynamoDB and optionally used by Amazon Q. Sixth point, user uploads or attachments stored in Amazon S3. Logs can be seen in CloudWatch as logs sent to CloudWatch. The above figure shows the architecture of AI Health Companion. We have used API endpoint from Bedrock, and the model is deployed on Anthropic Claude Instant v1. Here the front end works. The bot replies for a prompt, "I have a sore throat." Bot: here are some tips that may help relieve a sore throat. Gargle with warm salt water. Dissolve 1/2 teaspoon of salt in a cup of warm water and gargle a few times a day. The salt helps reduce swelling and soothe irritation. Suck on lozenges or hard candy. The sucking motion produces more saliva to coat and soothe your throat. Look for lozenges containing menthol or other soothing ingredients. Drink warm fluids. Warm liquids like tea with honey or warm broth can ease a sore throat. Avoid very hot liquids that could further irritate your throat. Use a humidifier. Low humidity can dry out your throat. A humidifier adds moisture to the air and helps reduce throat dryness and irritation. Rest your voice. Try not to talk too much if your throat hurts. Give your voice a rest whenever possible. Take over-the-counter medication. Throat lozenges, sprays, or pills containing numbing agents like benzocaine can temporarily relieve pain. Ibuprofen or acetaminophen can help reduce swelling. Gargle with salt water and vinegar. Mix 1/2 teaspoon each of salt and vinegar in a cup of warm water. Gargle and spit a few times a day. Apply a warm compress. A warm, damp washcloth placed around your throat. The bot replies for the prompt, pain in legs. Bot: here are some potential causes and treatments for pain in the legs. Muscle strain or pull. This can happen from overuse or sudden exertion. Apply ice. Take an over-the-counter anti-inflammatory like ibuprofen and rest the leg. Gentle stretches or massage may help too. Shin splints. Repetitive impact can cause pain along the shin bone. Rest, ice, compression with an elastic bandage, and elevation can help. Strengthening exercises, once pain subsides, may prevent recurrence. Tendinitis. Inflammation of a tendon, usually in the knee or ankle. Rest and anti-inflammatories can ease pain. Physical therapy exercises may help strengthen the muscle tendon unit. Arthritis, joint pain and stiffness, especially in the knee or hips, from conditions like osteoarthritis. Gentle exercise, weight loss if overweight, orthotics or braces may provide relief. Blood clot, seek medical care right away if leg pain is severe, swelling is present, or pain worsens with movement. Back issues. Radiating pain down the leg could indicate a herniated disc or pinched nerve in the lower back. See a doctor for evaluation. Neuropathy, tingling, burning, or numbness from conditions like diabetes damaging nerves. See a doctor to determine the cause. I'd recommend. The bot replies for the prompt, I have a severe headache and back pain. Bot. Here are some suggestions for treating a severe headache and back pain. Rest. Lying down in a quiet, dark room can help reduce pain from both a headache and back pain. Get off your feet and relax as much as possible. Heat or ice. Apply a warm compress or heating pad to the painful area of your back. For headaches, an ice pack applied to the forehead or back of the neck may help reduce inflammation and pain. Alternate between heat and ice. Over-the-counter medications. Try over-the-counter pain relievers like acetaminophen, ibuprofen, or naproxen. Be sure to follow dosage instructions. Combining a pain reliever with caffeine may provide additional relief for headaches. Massage. Gently massage the tight or painful muscles in your back, neck, and shoulders. Have a partner help or use a massager. Stretching and gentle exercise. Gentle stretches and movements like yoga can help relax tense back muscles. But avoid anything too strenuous when in pain. Hydration. Drink plenty of water. Dehydration can worsen headaches and back pain. Apply a cold/hot pack. Alternate between applying a cold compress/ice pack and a warm compress/heating pad to the painful areas. See a doctor if over-the-counter treatments don't help within a reasonable, e.g., I have a fever and headache.